Hi everyone. It's been a nice day today. I was able to come to Holland and see some people that I haven't seen in person in many months. It's been great to see some of the participants, and things seem to be going pretty well. This has been a big week for many of us, though. Schools and colleges have reopened amidst all of these coronavirus precautions. Um, so I hope things continue to go well, and I'm thinking all of you are trying to balance the demands of managing school-age children with work and with other obligations. We are seeing an uptick in positive COVID cases, primarily in Ottawa County. So we will be watching the data very closely in the coming days and weeks, and we will be sure to notify you if there's any changes or if there's any impact on our operations. Making sure you and your families and all of our participants and their families are safe continues to be our number one priority. I do have some non-COVID related organizational updates that I'd like to share with everyone today. The first is on intake and marketing. So just this week, we went live with a brand new CRM software called Enquire. CRM stands for Customer Relations Management or Customer Relationship Management. And it's basically a industry product used by sales and marketing professionals to manage the referral relationships through real data that can be linked to our enrollment and our outreach activities. This software is used by all of the other Trinity Health PACE organizations, and it's also now being used by Life Circles in the two UMRC Porter Hills PACEs, Tomei PACE in Jackson and Huron Valley PACE in Ypsilanti. So we're excited to replace some of our old kind of antiquated Excel spreadsheets and our other manual tracking processes with an actual industry recognized product that will help us improve our intake and enrollment efficiencies and develop actual data-driven marketing campaigns and outreach activities. We'll be able to see more clearly what works, what doesn't work, what our conversion rates are, what our timelines are for enrollment processes. It can even integrate with email and some other functions to hopefully build some more efficiencies. So I just want to say kudos to Sarah and Amy and Alyssa, who are working hard to learn this new product and have worked hard to set the product up so that it can be most useful for us going forward. Speaking of enrollment and marketing, our current census in Muskegon stands at 205. Last September, we had 227 participants, and the year before that, we had 231. In September of 2016, so 4 years ago, we actually had 251 Muskegon participants, with less staff members than we have now. I'm just telling you this because it's significantly below where we need to be. And I know that COVID has greatly impacted our ability to enroll, but we must continue to prioritize growth in order to maintain the revenue we need to support all of our expenses and to do all of the things we want to do with innovation and with making our care better and with keeping our facilities up to date. It's tough because on average, we experience 4 deaths per month in Muskegon, and that's been for the past, I think, 2 years or so. That's our monthly average. And on top of that, we have another 1 to 2 deaths per month, or not deaths, 1 to 2 disenrollments per month. So really, we need to consistently enroll at least 8 people every month in order to make any progress in our growth goals and to bring us back up to the level we were 4 years ago, 5 years ago. I'm telling you this because I just want everyone to be encouraged to prioritize growth. You do a wonderful job about responding quickly when Amy brings potential participants to you So I want to thank you for that, and I want to continue to encourage you to keep doing that, as well as just to identify some maybe opportunities that we haven't thought of for increasing referrals and to helping communicate our program to people in need. I also wanted to just give you a quick update on one of the areas that our board of directors identified for us to work on when we did our last strategic plan. So we did our last strategic plan in 2018, and they identified 6 strategic goals. We've done pretty well in those most of those areas, and one of the areas that I think we've done the most work on and we've made the most improvement on is what was identified as goal number 5, which is build and strengthen our managed care infrastructure to better understand risk, ensure compliance, collect and utilize data, and respond to potential competition from managed care organizations or other competitors. So I'm happy that we focused on this, because in the last 4 years there have been a lot of changes at the local, national, and state level. There are a lot of programs and services that are being offered now that weren't here when we first opened, and it's great because I think older adults want to remain in their home, and we've seen that people living in congregate settings in times where there's a pandemic especially have a much greater likelihood of infection control issues. So the other thing I think is every state in the nation is moving toward managed care products for Medicaid, and it's a way to make sure that the states utilizing their taxpayer resources appropriately, but also they're saying in good managed care programs where care is coordinated and there's more focus on prevention, quality can be better. I know that's arguable, but at least with PACE, I can say with great confidence that quality is better, people have better outcomes, and we do save costs. So in order to demonstrate that, people don't listen to nice, happy stories, that's part of it, but they want to actually see data, and they want to see proof that the services we provide are of value and that they are being provided in a cost-effective way that not only doesn't lead to negative consequences, but actually improves health outcomes. So a lot of what we do are basically working on the back end, trying to figure out how to translate all of the great things you do every day as IDT members and direct care providers into quantifiable data that can be measured and compared with other types of long-term services and supports or health plans. So we've done things like have some good chart audit processes now. We worked with our provider panel to get them to submit claims electronically. We've worked and continue to work really hard at paying claims electronically and getting rid of kind of manual systems to do that. We're working to make sure that all of the services that we pay for were actually delivered as they were authorized. So that's a lot of the kind of compliance back-end work. Service delivery requests. We've all been working very hard to make sure that we are complying with PACE regulations. And we've done a great job. In 2019, 53% of our service delivery requests were non-compliant. 2020, that is only at 9%. So great job, great work. We need to be 100% compliant, but we've obviously made huge gains there. The other big thing that the state is going to be requiring of us starting in January is that we will need to collect and submit Medicaid encounter data. So this will be a major shift in our administrative practices, but it will also mean a shift in how those of you who are providing care to participants document. So we need to have some very clear documentation standards, and your documentation will now be used to generate an encounter, which then will be reported to the state. And the state will then analyze all of the different encounters of things we provide with the other PACE organizations in Michigan, as well as other home and community-based services, just to get a better picture of how Medicaid dollars are being used. So I see this as both a challenge and an opportunity. The challenge is we just have to create new systems and processes for ensuring that our documentation is done on time and done accurately. So for some of you who have maybe developed some sloppy practices and aren't real good about documenting, it's going to be a harder hill than for those of you that are really good about documenting. So I'm just putting that out there. I do want to make sure that we continue to focus all of our energy and efforts on providing wonderful care, but that care needs to be documented so that we can demonstrate value to our legislators and our regulators. The other thing is it will help us do is I think if we get very good at collecting data, we can actually begin to data mine and pull out information that will hopefully help us with care planning. So for instance, if we identify certain participants over the course of a few months have higher utilization or lower utilization in certain areas, and that utilization has a direct correlation with maybe acute episodes of care or certain illnesses or infections, we can start to try to understand all of that and then focus our team and our care planning around that. So like I said, it's both an opportunity and a challenge, but because we're being asked to do this, it's going to be required that we do this. I say let's try to figure out how to make the most of it and how to actually make it value added instead of simply an exercise of compliance. We've done a lot with working with our contracted providers, so automatic adjudication of claims. I know that most of you are probably a little bored or blanked out with that, but in the business side of things, that's exceptionally important that we are able to process claims timely, because all of the people we work with want to be paid on time and want to be paid for the services that they provide. So we've increased the number of claims that are processed without error, and we continue to make improvements each and every month that we work on that. So I just wanted to give you that update. There are things that COVID is forcing us to do that sometimes distracts us from the strategic direction that our board laid out for us a few years ago. And we are still required to work on those strategies and goals, regardless of what's going on with the state of our pandemic. So thank you all for listening to me. Thank you for continuing to work hard each and every day. And I also want to just remind everyone that Labor Day is Monday, so have a good 3-day weekend. If you're on call this weekend, thank you. I know that that's extra work during holidays, and I appreciate you taking the call. And I also wanted to just make sure that you're safe. If you are in gatherings, make sure you're wearing masks and social distancing and protecting yourself and your family. Thanks again.